For years, the people of Borno State endured the devastating impact of persistent insurgency. This reality compelled Governor ZULUM to prioritize the creation of a healthy and productive citizenry through massive investment in the healthcare sector. Despite the severe setbacks inflicted on Borno's health system by the conflict, Governor ZULUM has since taken office demonstrated an unwavering commitment to revitalizing healthcare for his people.
Let me begin by appreciating His Excellency, the Executive Governor of Borno State, Professor Babagana Umar ZULUM, who has got healthcare of the citizens of Borno in his heart, as a result of which, day in, day out, he is embarking on more projects to strengthen and improve the healthcare system. Your viewers may wish to recall that as a result of the 16 years of insurgency in Borno State, we have witnessed 45% destruction of our healthcare facilities. And as a result of which, we also lost a huge number of human resources for health. Some were abducted, some were killed, some were, suffered from post-traumatic stress disorder. This is the background to it, and His Excellency decided to embark on a completely new trajectory for the healthcare. As a result of which, he started with infrastructure. This infrastructure includes primary healthcare and secondary healthcare. Because of the depletion of the human resources for health, he embarked on a journey where more healthcare personnel would be produced in the health institutions, and that includes doctors, nurses, midwives.
Today, the entire health system of Borno is being restored to vitality, positioning the state at the forefront of delivering quality healthcare services in the country. Primary and secondary healthcare are receiving significant governmental attention, encompassing both physical infrastructure and human resource development for health. The multi-billion naira Kashim Ibrahim University Teaching Hospital and Medical College stand as a testament to the administration's commitment to elevating the healthcare sector to a world-class standard. In addition to this lasting and fitting legacy of the teaching hospital, the administration also upgraded Mongono General Hospital in northern Borno and Goza General Hospital in the southern part of the state to specialist hospital status. This was done to provide high-level care and to streamline referrals to tertiary institutions across the state. Furthermore, these tertiary institutions will serve as training grounds for medical professionals, thereby helping to address the critical shortages of manpower in the healthcare sector.
Excellency embarked on a journey of construction of State University Teaching Hospital. This is a giant project for which the people of Borno State are immensely grateful to His Excellency. Let me give you an example that the WHO recommends one doctor to about 600 people. In Nigeria, especially in the Northeast, you see one doctor to over 10,000. And in some rural areas, maybe even 40 or 50,000. So because of this background, the importance of the teaching hospital can be appreciated by your viewers. And therefore, now the teaching hospital is completed and it's about to be commissioned. And the medical college is completed. As we speak, we have medical students who are taking lectures on a regular basis, as well as nursing students have also commenced. Let me also add that the Medical and Dental Council has already given approval for the teaching hospital. and also the Nursing and Midwifery Council has given approval for BSc nursing in the teaching hospital. And furthermore, we have also seen during this His Excellency's tenure of 6 years, 2 new nursing colleges built. College of Nursing in Monguno and College of Nursing in Goza. And this, and let me add that already the Nursing Council of Nigeria has been to Monguno and Goza and gave us approval. So we are kickstarting with 304 students in Monguno and 304 students in Goza. So the scenario in the next 2 years to 3 years is such that Borno State alone in its healthcare institutions will be producing about 1,000 nurses and midwives. And this will squarely address the issue of human resources for health in the state. And furthermore, the lack of doctors is a big problem, and therefore the medical students will have commenced their studies 2 years running now. So in the next 3 years, we shall be graduating medical students and dental students in the Kashim Ibrahim University Teaching Hospital and Medical College. And this will squarely address the issue of manpower within the state.
The state secondary healthcare system has seen transformative investment through the construction of new general hospital and the comprehensive renovation and modernization of existing facilities. This initiative directly aligns with a 25-year development plan and 10-year strategic policy of the ZULUM administration, all focused on delivering quality healthcare services.
The situation before His Excellency Governor Babagana Umar Zulum, CON, MNI, came on board, there was insurgency, and some general hospitals are inaccessible. For example, in Damboa, the entire hospital was occupied by, IDPs, so much so that it could not function as a hospital. The entire compound and even the hospital wards and everything was occupied. And in some places in the northern part, they could not, some were bombed, some were destroyed, set on fire, and therefore it was not possible for them to function as hospitals. So His Excellency Governor Babagana Umar Zulum embarked on, building bigger and better in terms of hospitals. And in this year's budget alone, we have seen, meaning 2025 budget, we have seen about 6, general hospitals being built. This included General Hospital Mafa. It included General Hospital in Uba, General Hospital in Gubio, in Magumeri, in Gajiram, and also General Hospital in Lassa and Kukawa. These are all, taking shape and will be completed this year. As a matter of fact, our recent visit to Gubio and Magumeri, the hospitals have been completed. It needs equipment. And previous years, we have seen new general hospitals built, including General Hospital Kaleri, which is outskirts of Maiduguri. We have also seen specialist hospital in the form of, the orthopedics hospital is under construction. It's about 80% completed right now. And also, we have also beefed up our facilities in the specialist hospital here in Maiduguri so that we can embark on more, more patients, more doctors, more offices, and more accreditations for our doctors, so that we can be able to give a service that is internationally best practice.
Additionally, the new Emergency and Infectious Diseases Center in Mejikri has been completed and fitted with state-of-the-art equipment. Furthermore, the general hospitals in Kondiga and Bama have been fully renovated. Moreover, the construction of newly general hospitals in Mafa and Dikwa have reached an advanced stage of completion. Similarly, the new 450-bed capacity purpose orthopedic hospital in Mejikri is also in its final phase of construction. According to the site engineer, the purpose-built orthopedic has different departments and units. If completed, will end the long journeys and searching for orthopedic care.
Yeah, where are we now is this. Let me probably say we are running towards the final stage of the project, because if you can see, the project was sectionalized in 6 aspects, which by my right hand side, we have A and E. Then at the opposite side of the A and E, we have outpatient and the pharmacy departments, which are on the ground floor. So at the topmost level of the distance of the A&E and the outpatient and the pharmacy, we have amenity ward, which is at the left side of the distance. You can see the block work is getting to the lintel level, where we are planning to cast the lintel, while the other side of the amenity ward, we have admin area. We've casted the lintel at the top. The block wall has been completed to the lintel level, and we've taken it to the roof beam. So what we are expecting at the admin area is just to cast our roof beam and put our work start commencing on the roof. That's the aspect of that. Where we are now, then, I said earlier on that the structure is sectionalized into 6 aspects. At the other side of where we are now, we are at the center of this thing, radiology and pathology. Where you are facing your rear side of the structure is the radiology. Then at the top of it, the work has been completed and the plastering has commenced. Because we make sure that we want to meet up the time. So the program of work we schedule, want to make sure we utilize it so that we can achieve the time frame. So at the top of the radiology, we have inpatient ward, which are categorized in 2 aspects. We have for male and we have for female. At my rear side, the other side is the pathology. So at the pathology, we've completed this thing, and almost internal plastering has almost completed. In fact, if I may tell the viewers, the support we had so far in this project, that's through the Commission of Health. He has been doing a very tremendous work and giving us a very good support in order to meet up the required time. And as well, he also emphasized on the quality, which I believe he comes there and see himself. He monitors the quality himself, and he makes sure that we follow to the later, which he himself see. So Commissioner of Health has been doing a very tremendous work on this project, and which I have to acknowledge him that he has been doing a very good job. So more grace to his elbow. Then I won't finish my statement if not commending His Excellency, sir, Professor ZULUM, by bringing this kind of a project to Maiduguri, because it will serve a lot of benefit to the people of Maiduguri. So I commend His Excellency, sir, and I also commend the Commissioner of Health.
In southern Borno, the newly established general hospitals in Dambuwa has been completed, equipped and commissioned by the ZULUM's late administration, while that of Borgu and Shani local government areas have been completed and equipped with cutting-edge facilities awaiting formal commissioning. Meanwhile, the eye and dental hospitals in Biu have already been launched and are fully operational. The new General Hospital in Wuba is in advanced stage of completion. In addition, the general hospitals in Biu and Guza have undergone complete renovation.
and the previous year, the construction in 2024 of Damboa General Hospital, new one, as well as the Brigadier Abakari General Hospital in Boloritu, as as completed and was commissioned last year by His Excellency and the Minister, Coordinating Minister for Health. And also we have embarked on complete renovation, complete bigger and better of the Molay General Hospital, where it's been in existence for some time, but now is going to serve as a full-fledged general hospital with maternal and child health departments, including operation rooms assigned. So we are looking at so many general hospitals in the state. As a matter of fact, these new ones, once completed, we're looking at over 50 general hospitals in Borno State alone. And also, we're looking at making General Hospital Monguno and General Hospital Biu as specialist hospitals. And that will ensure that people in the southern and northern part of the state can have all the investigations and treatments within the locality, such as in Monguno and such as in Biu. And as a matter of fact, His Excellency, during the period under review, has also constructed and commissioned specialist hospitals in the context of eye hospital and dental hospitals in Monguno and in Biu. And these have already, commenced work. As a matter of fact, on the very day His Excellency commissioned Monguno and Biu, the eye hospitals, they were operating, doing cataract surgery there and then. And let me also raise this, that His Excellency graciously approved free cataract service for 10,000 patients. So as a result of which, Borno is not charging anybody kobo for having cataract operations. So for that, we are immensely grateful to His Excellency for his magnanimity. And I'm sure the people that I've interacted with have always been very grateful for this very kind gesture.
Despite the Borno North region being the former epicenter of Boko Haram insurgency, Governor ZULUM's administration has defied the security challenges to deliver tangible dividends of democracy to the area. Recently, Governor ZULUM inaugurated an eye and dental hospital in Monguno. Furthermore, the General Hospital Gajiram, Ganze local government have been commissioned this year, while General Hospital in Benishek Kaga local government have been completed and are now awaiting formal commissioning. Meanwhile, the new general hospitals in Magumiri, Gubiu, Kukawa, under construction, are at advanced stage of completion. These efforts collectively represent a significant step in bringing quality healthcare closer to the people across Borno State.
We will continue to express our profound gratitude to His Excellency, the Executive Governor of Borno State, Professor Babagana ZULUM, for these game-changing innovations and transformations of the health sector in the state. It's a legacy that will the people of Borno State will cherish for a long time to come. Words cannot really capture our appreciation for His Excellency, the Executive Governor, for devoting so much to the health sector. As you are aware, Borno State has surpassed the requirement of health financing of WHO of 15%, both in the 2024 and 2025 approved budget, and we are seeing all these developments in the health sector in terms of provision of health infrastructures, several new ultra-modern hospitals cropping up in nooks and crannies of the state. General Hospital in Mafa, Dikwa, Uba, Gubiu, Magumeri, so on and so forth. So I think Our immense gratitude goes to him. Then posterity will always judge him for transforming and reforming the health sector in the state.
Primary healthcare serves as the core and foundation of health services. Strengthening primary healthcare is essential to achieving universal health coverage (UHC). This is why the ZULUM administration is leaving no stone unturned in revitalizing the entire primary healthcare system.
Primary healthcare is the goalkeeper, and it will treat the patients and don't allow the patients to go to general hospitals wherever possible, and where they needed to go, they will fast track and facilitate their going to hospitals. So across Borno State, our primary health cares have suffered from the mayhem that had taken place in the state through insurgency, and therefore new ones have been constructed. At the moment, this year alone, in 2025 a year, His Excellency has revitalized, renovated, and provided, accommodation for staff, use of solar in the premises, as well as solar boreholes in 135 primary health cares within Borno State. And really, I urge you to show the places you've visited, the primary health cares, where they have been renovated before and after, and you will see that the difference is humongous. And as a matter of fact, also, these primary healthcare centers are now receiving their drug supplies directly from the Borno State Drugs and Medical Consumables Agency. This is an agency created by His Excellency in 2024, and which is supplying drugs from a sure source to the entire population of Borno State. And since the establishment of the Drugs and Medical Supply Agency, the lack of drug syndrome that occurs in our healthcare facilities has tremendously reduced. And our aim is to make it even better by eliminating it completely. Previously, fake drugs have filtered into the system, and some people don't survive and are not treated. Therefore, people die as a result of fake drugs, and some do have severe reactions. Some of the reactions are very serious, like Steven Johnson syndrome, which can even kill a patient. So we're very grateful for this gesture by His Excellency.
I want to welcome you to our newly improved farmer-grade warehouse, farmer-grade standard-grade warehouse. As you can see, these are the modern shops we have in our warehouse. This is where we keep all drugs and consumables for the state, essential medicine, and also as well as consumables for the state. And this is done according to standard way of arranging things. In the warehouse, if you see up and down, you see the walls, the way it's insulated. You see down is the epoxy floor that I mentioned earlier. When you look at the shelves, you see we have numbered these shelves. Rack 1, Rack 2, Rack 3, C1, C1, C2. This is our own way of arrangement, that these numbers you see, it is what is being replicated at the info. Because we are trying to adopt our e-inventory of keeping our records, data management. And this is, we are now even trying to expand right from the store to the last mile delivery. For example, specialist hospitals, we have started link with them now. We have installed their own software there now. We are in the process of training. So procurement for facilities like specialist hospitals is going to be They will start from the facility down. They don't have to come down here. They will make their procurement from specialist hospital, and then they will send us. Then we pre-pack and get ready, and then we now issue to send it down to the facility. So these are some of the things we have seen, I've been saying about. And then when you look at the arrangements, the arrangement is simultaneous. It has been arranged in a standard way of doing things. As also part of the guidelines, if you look at it now, we also have a temperature monitoring device in our warehouse. We measure temperature of this warehouse at time interval, morning and night. We have a temperature chart up there where we keep temperature of the facility of this warehouse in the morning and in the night, so that we do it according to national or standard guidelines of keeping things.
In primary healthcare is an essential healthcare based on practical, scientifically sound, socially accepted method and technology, made universally accessible to individual, families, and community through their full participation using appropriate technology in the spirit of self-reliance and self-determination. So we have, this is the reason why I started with the definition of primary healthcare, what the services were rendering combined within the definition of primary healthcare. This is a standard definition. So we have components that compose the primary healthcare, and these components are what we have been doing services in this service. We have 10 components. The components are, we have family planning services, we have antenatal services, child welfare services, we have immunization services, we have potable drinking water sanitation services. These services we have been going around the community. We have been going house to house, doing house to house search, outreaches. Then we have nutrition services. We have mental health. We have been treating mental illness. We are giving them drugs. Then we have other services like treatment of minor ailments. This is our standard.
Today, every political ward in Borno State has at least one fully functional primary healthcare center. In this year alone, the Borno State government has rehabilitated and equipped over 135 primary healthcare centers. A visit to several upgraded facilities such as those in Borno State Central, Abaganaram, Bolori 1, the Comprehensive Primary Healthcare Center in Gwengi and Wulari, as well as primary healthcare centers Yarwa MMC, Maimusari, and Mashamari, revealed the tangible impact of these improvements on service delivery. Each of these centers have been provided with a solar power supply, a reliable water source, and 2 units of 2-bedroom flats to ensure effective and localized healthcare services. Other primary healthcare centers visited include Yarwa Peace, Malakachalla PHC, Bolori 2, Gwengi 1 PHC, and Fatima Ali Sharif PHC in Mejikeri. Additionally, in Jere local government centers, such as those in Mairi, Shukari, Furi, and Dalaram, were inspected. The officers in charge at each location confirmed that all services offered are completely free of charge.
Professor Babagana Omara ZULUM, it has, what he has been doing, it has been done to primary healthcare in particular. He has touched the lives of all the healthcare, all the communities, either in the primary healthcare, secondary healthcare, and the tertiary. But in the primary healthcare, most of the community, because there are almost all the wards in Borno State, there are primary healthcare centers during the tenure of Professor Babagana Omar ZULUM. Now, I don't know the ward that has no primary healthcare center, and this is what primary healthcare approved, that almost all wards must have primary healthcare center. So Babagana Omar ZULUM has done that, and we have now medical equipment, we have drugs, we have staff that are being employed, and the most thing that I must have appreciated is our salaries, the salaries of staff. Now, now our salaries in the local government has been improved to 100%, especially my own salary. Our own salary, almost all of the staff, now we are enjoying. Alhamdulillah, I appreciate it for what has been done. All our staff, we have more free drugs now, more free health services now, because every month we have been collecting drugs from the medical store. These drugs that we have been collecting is from the Primary Healthcare Development Agency plus maybe sometimes other partners. But now most of the partners have gone, And now we have been collecting monthly drugs from the Primary Healthcare Development Agency. And I have to appreciate the impact our commissioner, honorable commissioner, since he has come, he has impacted many things to the primary health care, especially training, capacity building. We have many capacity building. Now we are being trained on eye health care. We have been treating eye care now, but before we are not treating eye care.
His Excellency Professor Babagana Umar ZULUM on 1st of July 2022. So the people of this community are very happy about the commissioning. So he built a primary health care here, and the people of the community are very happy about it. And they are having their free drugs here. Rendering GOPD, General OPD, labor and delivery, we are rendering ANC, antenatal care. We are rendering RI, routine immunization, laboratory services, family planning, and free drugs. All are free.
Well, under this project where general renovation of the facility has been done everywhere, all is general, all the wards and offices, all the facility has been renovated. An upgrade of our solar by installing lithium battery. Before we are using this normal solar battery, but in addition, lithium battery was added to our previous battery, so our light or power is 4 hours with the upgrade. So we are opportune to have staff quarters. Is ongoing. It's almost in the finishing stage. Staff quarters is being built in the facility, and our staff are being trained, taken to Gombe for SBBC training, both the mentors and the champions. After the training, they are able to implement by using the upright marks for resuscitation and using the appropriate marks to resuscitate the babies. Before we are not, the one we are using before is not effective as this one. So we save life. So then the SBBC, coming up the SBBC, we are able to resuscitate babies perfectly and 100% successful. Before we are rushing, if we have this case, we rush the baby to SC. We have our SP stabilization center for running by the NGOs. We have to go there, going up and down, but we are able to resuscitate our baby successfully here in the facility now.
And what we have been trained is about safer birth bundle of care, which is 7 babies and mothers within this golden minute, which is 60 seconds. And in among the trainings we have undergone, we have training tools, and we have training tools and clinical tools. In the clinical tools, we have the Mama Bete, Mama Natani, and neonatally. Because the reason why it's called clinical tools is we can use them like we're using on a live patient, so that we will be expert and conversant with them before using it on a live patient. While the clinical tools are the tools we can use directly on our patients, which are the Moyo, which is used to monitor fetal heart rate, and the Neobit, which after the baby is being delivered immediately, we now place the Neobit on the chest of the baby to monitor the neonatal heart rate. And we also have upright bag and mask, which is used for ventilation.
Okay. This facility was opened on the 8th of October 2023, which is being commissioned by His Excellency, our able Governor, Babagana Umar ZULUM. When the facility was opened, patients have started coming here from time to time, and it is open up to 24 hours in a day. We usually receive about 800 to 1,000 patients, OPD patients in a week. And we conduct deliveries of 20 to 30 patients in a month also. And all the mothers and the women that are coming to the facility are free of charge. And we have RUASA, who provided us with drug revolving fund, of which we are running it up to now. And it has made the facility busy from day to night. And we have services that, this type of services that we are providing in the facility are outpatient department, which is OPD cases, we attend to it. And we also attend to ANC, which is antenatal care for pregnant women, family planning. We have our laboratory for minor cases, tests. We have our test kits for malaria, widal, and the rest. And also we have our pharmacy store and dispensary where we provide free drugs to our patients. We have BOCHMA enrollees in the facility, which enrolls about 344 clients in their catchment area. I have about population of 35,688, of which half of them are being enrolled by the government, which I say thank for Babagana ZULUM, who has the effort of bringing such facility to such a ward, because they don't have any facility nearby. The patients that are here, the community doesn't have any nearby facility except this facility, which has made the facility very powerful for us. So we say thank for the Borno State government.
Furthermore, the Bama and Kondiga Maternity and Child Hospital is among the primary healthcare facilities that have undergone a complete overhaul. Zarmari and Gentilo Primary Healthcare Centers in Kondiga local government, as well as Mafa and Kondiga Primary Healthcare Centers, are also not left out of ZULUM Administration Healthcare Transformation Drive. In Southern Borno, the government has constructed or rehabilitated at least one primary healthcare center in nearly every ward. Communities such as Borgu, Lakudum, Walama, and Shani Town are among the many wards where Governor Zulum's administration has upgraded primary healthcare facilities to an optimal standard. Facility managers and local beneficiaries have attested to the positive impact of this project.
Gode mu ba iyaka don abinda ba ma taba samani ne muka samu, abinda a birane shine so ko mana kauye. Da asibitin da muke da shi dan karami ne wanda babu gado, illa kawai mu yi su immunization da sauransu, ba riga patient ba mu samu rike shi ba wurin karban haifuwa ba komai. Amma yanzu har ma abin da ya fi haka, don daga wani wuri zai gudu ya zo nan, don yana ganin asibiti an inganta shi kuma akwai ma'aikata wanda suke zama. So gaskiya muna godiya sosai, an inganta mu fiye da ake tsammani, don muna family planning, muna antenatal clinic, muna immunization, muna labor and delivery, muna admitting patient na daidai wanda za mu iya mu rike, muna referring patient, sannan akwai accident emergency duk muna da shi, muna laboratory, muna da pharmacy, muna dispensing drugs, duk wannan muna yi. Akwai gidajen kwana na ma'aikata. To ya kai room falo ya kai na mutum 8, wanda da ba mu da shi. Da ruwa shine major problem namu. Kowa in ya zo ruwa daily, da sai na sai ruwa na 2000 daily. To amma yanzu ruwa alhamdulillah muna da pompo. Ruwa yana shiga mana kowane toilet, ba mu da matsalar ruwa. Ga magani yana kawo mana magani na basic healthcare da na boshima, ga impact tana yi mana, kaga duk muna samun magani. Ga ma'aikata kuma an karo mana, da ni kadai in charge ne ciwo ne kadai, amma yanzu mun karu mun kai mu 5, ga akwai contract staffs duk muna da su.
Gaskiya, to God be the glory.
I have to thank His Excellency, the Governor of Borno State, Governor ZULUM. May God protect him and guide him. With this contract through His Excellency, former Deputy Governor Usman Durkwa, people of this area have been very grateful. They have shown their happiness because this facility have been here but is dilapidated. But as we cried to the governor and he listened to our cry, he come and rehabilitate this area. If formerly we used to have 10 patients, we have now 25. Because people have seen that this place is now rehabilitated and they know there will be improvement of services. So they usually come now. Everybody is praising the governor of Borno State now because of this work that he did here. Gaskiya ba karamin daɗi muka ji ba. Don kafin a yi mana gyara ɗin, gaskiya muna cikin wahala domin ko cikin ɗakunan ma baya ishe mu. Amma yanzu da aka zo aka yi mana gyaran olo, ko wanda ya shiga asibiti me shi zai sani cewa na da na yanzu ai akwai bambanci, ko kuma da kuka zo da kuka duba kun san cewa akwai bambanci ai. So muna godiya ma gwamnatinmu na yanzu, gaskiya sai dai mu ce Allah ya kara musu lafiya da kuma kwazo, don gaskiya su yi kokari.
In Kwayakusa local government area, new primary healthcare facilities have been established in Beta, Yamarlang, and Gusi, with numerous other communities in the local government area also benefiting from Governor Zulum's developmental initiatives. Significant government attention was directed at the Bio Maternity Center and the satellite cold room in Bio local government area. Concurrently, new comprehensive primary healthcare centers in Shafa, Boratay, and Tum were not overlooked. Facilities in Shafa, Karputu, and Hawul now have a new look, thanks to ZULUM's healthcare revitalization program. These efforts have transcended mere construction. All necessary equipment and resources required for effective primary healthcare delivery have been provided. Consequently, Southern Borno has fully benefited from this extensive undertaking as confirmed by facility managers and community members.
We are very grateful to His Excellency, the Governor of Borno State. We thank him a lot because he made a great deed to our facility. One, he provided, we have the Bochma, the basic health, and the impact. They all contribute in drugs, other testing kits, and other material for pregnant mother, and the rest. We have, they brought us medicine for the community, that is essential drugs. We made a great appreciation to the state governor for his well done. He renewed the facility. We have some building he made for us, like quarters. He also provided us with solar. He made a fencing, renovation of the roof, everything. He made a lot to us. We are very, very grateful. This we are rendering here. We are doing integrated health services. We have the ANC, family planning, immunization, nutrition, OPD, ACT, DOT, and the rest.
The ANC, we used to see most of the women that are pregnant, they will come by stages. They come for first stage, second stage, third stage. Yeah, we have RI site that is normally for their routine immunization. We used to give the antigens that will protect the child from getting an infections into his body. So we have immunization site. We have almost delivery site that I took you there. If you come to this site, we have quarters that Governor Professor Umar ZULUM is building for us, for the nurses and midwife that are here for rendering the service. Because sometimes in the night, if somebody is far away, before she come, it will become something else. So that's why we decided to build a 2-bedroom here for the nurses and midwifery. We really appreciate, because if you see these days, we are having problem with light. So as we get this solar, it occupied all the primary health care here. So both the MPI, MCH, and the Solina Hall is all 24-hour services we are rendering now because of the solar. So we don't have problem apart from that one.
In northern Borno, despite prevalent security challenges, the ZULUM administration's commitment to improving healthcare infrastructure has not wavered. The General Hospital and Mother and Child Care Centers in Damasak, Mangono, Magumiri, Kubio, and Baga in Kukawa local government area have been completely rehabilitated to standards by the current administration. Currently, Borno State operates 50 general hospitals and maintains functional primary healthcare centers in every ward, establishing a robust network of public health infrastructure. These developments stand as enduring legacies of Governor Babagana Umara Zulum's transformative leadership in the health sector, a testament to this resolute commitment and strategic vision for revitalizing healthcare delivery across the state. Despite the formidable challenges posed by protracted insurgency, his unwavering dedication to restoring normalcy and advancing the progress of Borno has earned widespread recognition throughout Nigeria.